Thank you again for your time, Dr. Botstein. You're a rheumatologist. You're on faculty here at DeKalb Medical Center. You're also a founding member of the American College of Rheumatology. What is psoriasis?
Psoriasis is a condition in the skin where the skin is hypertrophic and you make too many cells. Something's irritating it to do that. What causes it is probably an autoimmune process where the immune system is overactive and attacking the skin in a way that causes it to proliferate.
How common is this, and is it becoming more common?
10 to 30% of the adult population has psoriasis, and 1 to 2% of children. Men and women both get it. There are two peaks. One is around age 30 and the other is around age 60, but it can occur from early childhood through senescence.
This is not contagious, right, in any way?
In no way.
Because people oftentimes will see somebody who has these significant skin lesions, and I imagine just emotionally it must be very challenging for them because people avoid them.
It was many years ago that the TV commercials would recommend this or that product for the heartbreak of psoriasis, but there's absolutely no chance of contagion from this disease, and you don't catch anything from it, and you don't suffer any harm from it. But for people with psoriasis in very visible places, it's life-altering.
Is it curable?
I don't think we'd call it curable. Curable would mean you would take something, it would be gone, you would take that medicine away, and it would still be gone. I think it's treatable, it can be put into remission now in a way that never could have been even conceived of a few decades ago.
Have we come to that point now with the availability of medications that you shouldn't have to suffer with psoriasis?
10 years ago, I would have a lot of hesitation. 20 years ago, I would say we can't do much at all. But now we have drugs that, since we recognize this as an autoimmune disease, that attack the immune system in a way to try to limit its ability to harm the skin. When you have an chronic inflammatory condition, it may suppress your immune system and make you more susceptible to certain diseases. But the cause of the inflammatory condition is a component of the immune system that's doing the attacking. So it's overactive. So there are parts of the immune system that are overactive and parts that may become underactive. And what these drugs do is they target the overactive components of the immune system that seem to be causing the problem.
If a patient goes from having psoriasis to having psoriatic arthritis, is that just because the psoriasis has gotten worse? Is this a natural sort of part of the disease?
I don't know the answer to that. Why some people get psoriatic arthritis and some don't. But the incidence of changing from just psoriasis to psoriatic arthritis is between 10 and 30% of people with psoriasis will get psoriatic arthritis.
Patient comes to you and says, you know, I'm suffering, I have psoriasis obviously, and I have the arthritis symptoms now. Regardless of how long it's going to take, how confident are you that you can return me to a normal life?
I'd say very confident, very confident. I would point out that if you don't get this early, the joint is damaged, it doesn't get undamaged. It's never going to be whole again, and if your wrist didn't work, it's not going to work. If it's ongoing destruction, that we can stop in the vast majority of patients. I think education is the key, whether you're educating the patient or the family, encouraging them to do the right things. Stop alcohol excess, lose weight, healthy diet, and then take your meds.
And those other things, again, those lifestyle things, how big a difference do you think they really do make?
We don't see the effects dramatically because they're very gradual. But over time, maybe 50% of the benefit could be from lifestyle. It takes a long time to see those changes, but I think they're worth doing.